We needed to find a way to connect the doctors to things they were already doing anyway.
Initially, we were not at all certain, maybe Jim was, and he might have been, that we were going to be successful.
In the beginning, we didn't really have that clear a view of what the foundation was going to do.
Jim was clearly he just saw the huge potential, the unmet needs of the community, the desire of physicians to participate in something like this, the wonderful profile it would give us for doing the right thing.
Just a lot of experienced people involved in leadership who had a lot of different ideas, and it finally gelled.
My health is my wealth in many ways. I was repeatedly missing work, so I need to be healthy and be able to get to work to provide for my family.
My patients are grandfathers, grandmothers, neighbors. They are the people that watch my daughter while I'm at work. They are people who are very hardworking and they have to go to work even if they're in pain. They are resilient. They're good assets to our community.
I think the role of the foundation moving forward is captured by its mission, which is improving health and changing lives.
The foundation can be nimble, go here, go there, and do things for the public health that are harder for the medical society to do.
There's still a sizable portion of our community's population that has no access whatsoever. And what the Society Foundation has been able to do, I think, is broaden the number of people that can have health care provided in a responsible setting with professionals that are doing this on a daily basis.
We're moving ahead as a foundation. We're looking at immunization rates, colorectal cancer screening rates, breast cancer screening rates, and now we're moving into diabetes prevention for those who are pre-diabetic and at greatest risk.
This is what doctors went into medicine for. We went in not only to treat disease, but we went in to prevent disease.
If you are screened regularly for colon cancer, you have a 70% reduction in your risk of developing cancer and dying from the cancer. Before this program in San Diego County, the underinsured or underserved patients were not being screened.
We as a community need to help everyone in the community see what they can do to be healthy. It's what's going to make San Diego a healthier place.
Let's make San Diego County the healthiest county in the nation.
It takes partners, and the San Diego County Medical Society Foundation has been a phenomenal partner. Since 2005, they have done so much for San Diego County.
Making sure that the medical students know what's going on in Sacramento, what's going on in our practices at our stage of the life cycle, I think is essential.
Bringing those students up and opening their eyes to the opportunities of reaching out to people person to person is huge.
In San Diego, 1 in 6 people have diabetes, and the rate of diabetes is growing.
You always take care of people who need it, and you don't ask questions about whether they can pay or not.
I'm completely excited to show the nation that physicians not only care for their patients, but they care for the entire community.
We've extended our wings and we're flying.
There are people in your midst who provide these services free of charge. It's what we do. It's the heart of the foundation. It's the heart of Project Access.
There are people who are crying somewhere in San Diego or anywhere for medical attention, but they can't get it.
Imagine what a legacy we could create if we made San Diego the healthiest county in the nation.
Thanks so much for all you're doing for me, for you and your staff and Project Access and everybody that's involved and helping me out here. Because without them, I'd just be hanging out and not having any medical attention, which I need.